Chiropractic guys, Dr. Eric Smith, and today I'm with Austin Curry. Austin, how you doing today, man?
I'm good. How are you?
I'm good. Look at the size of this man. You would guess he is a trainer, and you played also some sports, right?
Yeah, so I did football, basketball, and track in the past and stuff, and now I currently, as of like this year, really got into bodybuilding. I'm 6'5", probably about 270 pounds, and just trying to be a better athlete, just trying to be a better personal trainer and stuff. So when I have the opportunity to learn from somebody else and also take care of my body, obviously I want to prioritize that and focus on my recovery.
Excellent. So he's in today. So the main things he told me is he's not in a lot of pain, but he's at this practice, and what I'm focusing on today is more performance. So he wants to grow. He's continuing on his journey to do classic physique, right?
That's correct.
Okay,
Yes.
awesome. So we were talking a little bit before, and he's studied a lot of Kelly Starrett stuff. So he's really good and done a lot with the CrossFit community in the past. But it's really good in understanding because he has the Supple Leopard, and he has a book like Desktop or Deskbound or something like that, right?
And he also teaches you how to run and things like that, how to walk like correctly and stuff. Because a lot of people walk like kind of like duck feet out.
Yeah.
He promotes and encourages to walk toes pointing forward, staying on the outside of your foot and whatnot. So just mobility, flexibility, joint mechanics, posture. Like those are the things that he really kind of helps you improve on. And like once again, becoming supple like a leopard. Just being able to be mobile, have full blood circulation, and kind of basically increase the telomeres of your life and have some longevity in like the sports and career that you're in.
So that's what we're going to do today is with him. So he's got that part. So we're going to look and assess him. So I'm going to show you how I'm going to do that really from a point of view of I've done a slight verbal exam with him as to what's going on. But we're going to look at his posture, do an assessment so you all can see like what I typically do, not just from the pain point of view, but for somebody that's more of a performance athlete like himself. So I will have you go ahead and take those slides off. So we can go ahead and start this point, and I'll have you face that way.
Okay.
Now the first things I'm going to look for here is making sure his shoulders are level, and they're not. So his left one's slightly dipped from his right. So that tells me something right there. But starting at the very top, which falls in line with that, his occiput right here is higher on the right side than his left. So we know we have something going on here. And then from there, the man can squeeze his shoulder blades back and down, so he can kind of get in that position. Then his thoracics are pretty flat through there when he does. So let that relax. From that shoulder point of view to his right shoulder, when I kind of push in, his humerus, which is this bone here, is more forward. So he's kind of probably got more of an anterior rolled shoulder on the right side. If I had to guess from this point of view, that he probably sleeps a little bit more on his right side of his body than his left. But somebody like this too, if you're one of these people that has constant neck pain or tightness through here, getting a pillow that's going to allow your neck to be neutral instead of being like this all night long, or having to bring your arm up like that, is going to help to keep this to where it should be. But again, he's pretty wide, so you have to get a pillow that's pretty firm, that's pretty wide, and maybe even two to do that. So so we got that going on. And then as for like where we look at his pelvis here, so remember, a lot of people think this is your hips. Your hips are actually down here. Your pelvis line here, right, it's not too far off, but he's just slightly higher on his right. So he had mentioned before that he has, and what side was it that you feel like it was a little limited?
So I feel like something with my hips and stuff is I always feel like I'm putting all my weight on my right leg. I feel like it's almost as if my left leg is longer because even when I stand straight up, if I stand on my left leg and swing my right leg, it swings perfectly. But if I stand on my right leg and swing my left leg, it gets caught on the ground.
So that was a good assessment. He told me, and we look for that. Some chiropractors look for that, and movement specialists would. And so usually what that is you have your pelvis, and if it's rocked more forward on the right, so this is actually ahead, allowing him to kind of do some more movement, and he probably has more motion through his sacroiliac joint, allowing that. But if there's a restriction in the sacroiliac joint and this is kind of pushed back, it's already starting from the back, so it's not going to go as forward. So we're going to look at that as I have him lay face down, because the difference between doing a standing assessment and what we're going to do laying down is that his muscles are engaged now for his overall posture, but once I have him lay down, then we're not going to see that much of it. So I do want to do some orthopedic tests and such with you just for your neck, ensure that I can adjust you. So go ahead and have a seat here for him, please, and face that way. So from here, what I'm going to do is I'm just going to move your neck around, see how this feels. Feel the joints a little bit. Getting any headaches?
Nope.
And if you normally sleep, like sleep on your back, your side, all over, stomach.
Yeah, I sleep on my back for the most part.
Oh, good.
So here, when you go back here, I feel it a little bit like in here. Not like crazy pain where it makes me like wince or anything, but I could feel it. It's almost as if my head or something has shifted because I'm compensating somewhere.
Yeah, for sure. So usually in people that have more of a wider physique, this area called your CT junction, so your cervical thoracic junction, where the ribs come in and articulate with the first rib here, and into your cervical. This area tends to get tight on people because it's hard for them to do that. Normally, the lower cervicals do lateral movement, and from that angle you can't really see, but he's very limited on this side, which is going to create more of a pull over here because it's kind of pulling you more that way. So, but for the most part, shaking your head back and getting that range of motion is pretty good. You can go forward real easily. So really we're looking more at the idea of a little limited on your upper cervicals. You can go more to the right than your left. So a little bit through here and then a lot down here. So very good. But lower back's been doing pretty good. So I'll have you pop your hat off, okay, and then I'll have you lay face down for me, please. And when I did any of those range of motion, did they give you any pain or anything like that?
Nope.
So taking a look at this, bend his legs a little bit. So when I bring his legs up, if you kind of watch his pelvis, he starts to get a little arch in his back. So this tells me that his quads are a little tight from that. And so a way you can really kind of tell if it's quads and or hip flexors is usually this. If it starts to pop up, that's fine. But if I take and kind of combine the two here, and it gets a little bit harder. So it's hip flexors and his quads. Can you kind of feel how, like, once I brought your hip flexors into it by lifting that, that also added to how tight it got? And you could feel that tighten in your lower back when I did that, or no?
No tightness in the lower back.
Okay. So you just felt that more in your legs? Okay. So as for like getting the heel of the butt, we're about 35 degrees off of getting there. But he's got a lot of muscle to work through, and I'm sure through all those years of playing those sports, you probably have some scar tissue and such being tackled and taking some hits, right?
Yes.
Yes, for sure. Okay. And when's the last time you were adjusted?
Oh my, it's probably been over a decade.
Over a decade. Okay. So it's been a long time. So some of the things I'm going to do to prep for him to be able to get adjusted is I'm going to use a cold laser on his low back and then his neck, where I'm going to adjust. I'm going to move his arms down here. There should be one on the other side for you as well. So those of you that have been watching my videos, you see I use a cold laser. So what cold laser does is, Austin, you're not going to feel too much of anything. You probably just feel the head of the unit a little cold. But beyond that, you're not going to feel the heat of the laser. So what this does is this starts to encourage blood flow to the area. And I'm doing this before the adjustment because there's less blood flow because I haven't done any massage or any type of adjustment or anything to increase blood flow to that area. So I want to use this so it's encouraging it. I do the other stuff first, and typically what you'll see is there is already increased blood flow, so this isn't going to be as effective as what I'm trying to do. So as you can kind of see a little bit of a dip here. So he has a lot of pressure on his facets of the joints in the back because he's got so much weight up here. Your entire spine comes and wedges into your sacroiliac joints and puts a lot of load on your lumbar spine. So the point of that and what I'm doing here is really just to, like I said, increase blood flow. So later, as we get the adjustment, things are working, there's less chance it's going to tighten up from the movement we encouraged, as well as less chance it's going to be sore or have any pain later. So now, did you train today?
No, I did not.
Are you planning on training today?
I do.
Cool. What are you going to work out?
Today's going to be a lower body day, so legs, and I'll toss like a little bit of like accessory work in at the end, so I might do like a little bit of abs, maybe a little bit of arms.
Okay, so he's got a workout he's going to do. So a lot of people ask me like, hey, can I come in and get adjusted before I work out, or is that bad? Should I take a day off of getting a workout when I get adjusted? And I always encourage the movement before or after. So either way is fine. And the biggest thing I want you to do is make sure you just do some warm-up stuff, which I'm sure you kind of probably do. You don't just hop into it throwing a bunch of plates on something.
No, no, I don't do that.
So to kind of answer that question clearly, like, yes, you can work out those days. You just need to make sure you get your brain used to the new movement that we encouraged with the adjustment and making sure that you're following through and doing using good form, because your brain doesn't typically recognize the fact that your joints move better than they have. It's kind of like the riding the bikes principle. The idea of you haven't ridden a bike in a while and you get back on, sure, you can do it and you're going to go back into the old patterns that you did. But if the bike works a little bit differently and more efficiently, you're probably not going to be as used to that, right? So you want to make sure you warm up and kind of let your body learn the new pattern and use those muscles well. So I like the fact that you're getting adjusted and doing legs today. So is there a certain type of person that you typically like to train, or you train a little bit of everything?
So currently, I do a lot of push, pull, and legs. That's kind of like the rotation. Week to week, it kind of changes. Like as far as my off day goes. So right now I do like a 3 on, 1 off, 2 on, 1 off, and then 2 on, 1 off again. And then I go back to the 3 days. But I like that just because like pretty much I don't work out more than 3 days before resting at least 1 day.
Nice.
I feel like that kind of helps with my recovery.
Okay, that makes sense. So one of the big things that he's pushing on is making sure you get good recovery. So going to your chiropractor, getting in and listening to your body as well, to make sure that you're allowing your body to, especially if you're trying to grow muscles, that you recover. Because as much as you want to think that you're in the gym and you grow muscles while you're lifting, you actually are breaking them down, and then you need to recover, and that's where the nutrition, the rest, and everything else comes in. So I don't know about you, but I grew the most when I had the time in life that I could pretty much work out, eat, and then take a nap.
Yes, that's it. And that's honestly like what I'm able to do now with my work and the things that I do. It kind of like promotes that, like it encourages me to be able to pursue like this bodybuilding career and everything, because everything else is kind of solid. So I do get to get all my foods in, get steps in, get my cardio in, my workouts, eat the right foods, rest, try to take care of my body and like all the areas that need to be, just so I can, like I said, recover the best that I can.
I love that. So some of the points, if you couldn't hear it, that I really liked is he talked about how he basically split up his day. He got his overall movement in, not just focusing on killing it all the time, which is cardio. So just because you said your steps, but you did do some cardio,
Yes.
made sure that you got some rest, made sure you got your food, got your water, had your good habits.
Yes.
So, and that's what's leading to your success and growth so far, right?
Mm-hmm.
Awesome. Well, I'm ready to get to your adjustment. So, all right, big guy, we're going to get into it. I'm just going to walk you through it. I know it's been a while since you've been adjusted. So for those of you that don't know, when you hear that pop and crack, it's just gas being released from the joint. So it's like a vacuum when a joint gets stuck. And so when I adjust you, it releases that gas that's in there, which is also the gas that causes a chemical reaction for the pain sensation. So when that releases, then the joint's less fixated, and that's what we feel for as chiropractors. So I know a lot of you out there are addicted to crack. You know what I mean? You love to hear that pop and crack. We're going to see if Austin has a bunch of pops and cracks today, and as I've never adjusted him before, we're going to see how this goes. So we'll do some easy ones in your thoracics to start, a little bit through here. Nice deep breath for me. And let it all the way out. Nice. Let's move it a little bit better. So this is the area I was talking about, your upper thoracics, especially through here, you're really pretty stuck. That's why you're feeling a lot of this pain in kind of this area. So we're going to let those arms just drop them all the way to the side. You're a pretty wide dude. Let your neck relax as much as possible. Good work. Go ahead and lay on your right side and face me, please. Now we're going to work on getting the SI joint moving. Scoot a little bit closer to me if you would. There we go. Take this arm like that. I'm going to pull you out. Open that hand. I'm going to drop this leg off for you. Good. Let this relax. Good. Let's go to the other side. Scoot a little bit closer to the edge. Sure. Yeah, I'm trying. So I like to just drop this off and then use your body weight to help me out. Do this a little bit different. You got this. That relax for me. Good. I'm laying your back. Okay, so let's check out this neck of yours. So you normally sleep pretty well at night?
Yep.
Good. Let's let your neck relax in my hands. Cool. Okay. Good. So this one didn't release as much as I want. So normally what I like to do is sometimes just have to open the joints up by just rubbing on the facet capsule right around it. That's going to feel a little sore. Do you get muscle work and massage done regularly?
I was doing it for a while, and then probably about a month or two ago, I took on some new work, and then I wasn't able to do it as regular, but I was doing it every other week for a while.
Nice. Good. Awesome. I think this middle part of your back that didn't want to move, so I'm going to give you a nice little chiropractic hug. Okay, keep those arms nice and tight. Roll to me. Nice deep breath for me. And let it all the way out. Good. One more. Deep breath. All the way out. let's check out this. Any problems with your ankles in the past?
Nope.
All these years of playing sports and lifting, you seem like you've been doing pretty good at keeping this body healthy.
Yeah, I have a good body awareness, I would say. I've had some ankle sprains and stuff like that, but nothing crazy, nothing like too serious.
Nothing too crazy.
Never had to be in a boot or like crutches or anything.
Good. So what I'm assessing now is your plantar flexion versus your dorsiflexion.
Okay.
So you seem just a little restricted in your dorsiflexion. That could be just.
Side? Yep.
So I'm going to adjust you into that dorsiflexion. Just relax for me. Check out your knees. This is just kind of for meniscus health. Feel the integrity of the knee. See what's going on. And then just gapping the knee a little bit as we move. And this will also kind of open up the hip capsule too, which might be part of the issue of what you're feeling. So relax. Good.
Yeah, there's a cool technique that Kelly Stewart teaches when you're gapping a knee, when you put like a rope or a ball, like a tennis ball behind your knee and sit like in your squat.
Right.
Yeah, I do that before I'll squat and stuff sometimes.
Good. Okay, let's have you sit up toward me. Cool. Let's check out these wrists. So when you got adjusted before, did they just do spine adjustments or they do your...
It was like literally only spine, maybe like hips, that's it. Like the one where you cross over, I'm familiar with that one. Familiar with like sitting on my, or laying on my face and then doing like a mid-spine type of thing.
Gotcha. Your wrists feel pretty good, a little tight. Obviously, they probably don't get too much work on them, but we always beat up our forearms and our calves quite a bit. So it's important to me that we take care of the wrists and the hands. Make sure these are adjusted. Cool. All right, let's take a look at these shoulders. As I mentioned before, this one is the one that's kind of rolled more forward. So if you can kind of look, maybe from the angle of the camera, you can see that his right shoulder is a little bit more forward than his left. I'm assuming, because you said you're right-handed, correct?
That's correct.
Yeah. So we always do everything. We tend to like reach for everything. We do a lot with our right hand. So it becomes very common to have that more anteriorly rotated. So that's why I want to get him back. And because in his sport too, if he's going to go on stage, he wants to be as symmetrical as possible. So some of the things that we do is just kind of check there to see what's going on. And then I want to check the range of motion of his shoulder, see where he's a little bit more restricted. So with you in a building stage, how many calories would you say you're eating per day?
So currently I'm at 5,015. The last growing phase that I did, I got up to 8,137. And I was like 310 pounds. But yeah, so it takes a lot for me to be able to like grow, but I think that's why I have some pretty good potential, is just because like I've always kind of had like a big appetite, never really eaten in moderation, and so being able to like be a bodybuilder and with a lot of the like the obstacles being with the diet and the food, I like that's why I think I can do really well outside of my stature.
So those of you that are struggling to get 2,000 calories in, this man has to eat between 5,000 and 8,000 a day. Yes. So he doesn't want to hear you about this 2,000 thing. With this, relax for me. Good. This around. There we go. Good movement out of there.
Yeah.
Awesome. Let's see how you feel with the neck. Try to take your left ear to your left shoulder. Let's go to the other side. Okay. And then look straight forward. Try to go up straight like that. Good. Let's go to the other side. Good. So we have some improvement there. We're going to check out his low back and such too. The biggest thing is that if we don't get full range of motion back, usually there's some muscle work that needs to be done. This man's in the growing stage, so his body is constantly like working, growing. So so with him, we're going to continue, or what I would suggest for him is get more muscle work, getting constantly adjusted to keep him growing. Beside that, how do you feel?
I feel good.
Awesome.
Yeah.
So those of you, I'll put his link below in the comments so you can find Austin. Make sure that if you have any questions about training, nutrition, everything like that, man's on his road to growing and getting on stage, so we look forward to that. And then make sure you like and subscribe and follow us for the next videos. We'll see you next time. Thanks, Austin.
Thank you.